Hi everyone, I'm United States Senator Roger Marshall from the great state of Kansas. I want to thank you for the support you've given my family, my staff, and myself since coming to Congress. I appreciate you as friends, advisors, consultants if you will, and of course as fellow colleagues in medicine. And I'm honored to be asked to speak to those of you at the Take Medicine Back conference. For nearly 30 years, I worked as a private practice OBGYN, and for 17 of those years, I helped run our physician-owned hospital. I was surrounded by some of the greatest nurses and healthcare support teams that allowed us to deliver high-quality healthcare in rural America. But with the advent of the ACA, which was written by the insurance industry, along with meaningful use, our world in healthcare changed with physicians and nurses becoming data entry specialists. Additionally, I saw the future of docs being treated like a commodity that could be bought and traded at the whim of people who had never seen a patient, who couldn't take a blood pressure or start an IV. Look, very simply, one of the main reasons I came to Congress was to put docs and nurses back in charge of healthcare. I knew then, and I know now, patients like their doctors and they like the quality of their care, but what they don't like is the cost. I came to Capitol Hill with 3 pillars to fix the cost of healthcare: innovation, transparency, and consumerism. But now I've added even better nutrition as a 4th leg. To this end, our legislative priorities are to preserve the sacred patient-doctor relationship and get middlemen out of the way. We as a nation are spending plenty of money on healthcare. It's just being unwisely allocated. One big way our office and the Doc Caucus is impacting the life of physicians is our legislation that modernizes prior authorization so our patients get timely access to care. I'm honored to champion this legislation on your behalf. The support from the entire physician community underscores our legislation's significance to patients, healthcare providers, and innovators in drugs and devices. Now, another topic you wish me to discuss is our bill to help our ER docs. Look, I know how hard you work every day, seeing anything and everything that comes through the door. And whether it was the AIDS crisis or the early days of the COVID pandemic, not knowing how our own health would be impacted, doctors and nurses, x-ray techs, and phlebotomists, we all threw ourselves in harm's way, always exercising without hesitation our oath to heal the sick. And today, our ER docs are the face for the treatment of the mental health epidemic, along with the fentanyl poisoning of our youth. I do get it. I know how challenging and frustrating it is to try and take on this crisis in an ER setting. And while the White House and Congress reward your efforts with pay cuts, let me say thanks on behalf of the many, many, many lives you have saved and healed. You remain my inspiration to stay here and keep fighting for the rights of doctors. But now the same docs that saved us facing alarming rates of burnout and suicide. Indeed, the pandemic, along with the never-ending increasing clerical burden and government overregulation, has brought a heavy toll on our docs and our nurses' physical and mental health. Let me assure you, I do care. I understand your concerns. I understand the due process each of you deserves ensures we as physicians can fully carry out our promise to patients, to do the right thing, to fulfill our sacred oath without fearing retribution or termination by hospital administrators. Unfortunately, even inexplicably, our ER doctors don't enjoy these same protections. We've seen how due process, or really the lack thereof, harms patient care. Because of how poorly our ER doctors have been treated, ER residency slots are going unfulfilled. And at the end of the day, America and the people we care for will suffer, being denied the miracles ER docs and their teams have developed to save so many lives. Just think about what you and your nurses have done to impact strokes and myocardial infarction, along with sepsis and trauma in the ER setting. Without quality emergency room docs, these protocols will be left in an old binder as patients die and suffer the consequences. It just seems like our own federal government and frankly insurance companies can't get out of their own way, and their greed is literally killing people. Indeed, it's any wonder our nation's morbidity and mortality numbers are headed in the wrong direction. This trend indeed places our nation's health in a greater crisis. Our ER Heroes and Patient Safety Act, which you and the Take Medicine Back, along with our ER Doc Association helped author, closes the loophole and thus ensures that due process rights are protected for all ER doctors and ensures equality of rights, regardless of who employs them. After all, ER docs are people too. We deserve the same legal protections as all American citizens. Thank you so much for inviting me to speak at your conference. I'm sorry I can't be with you there in person today, but I'm with you every day fighting to take back medicine for docs. And remember, as you visit with members of Congress, get to know their healthcare staffers, and above all, tell your story.